everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and the founder of the website betterhealthwhileaging.net. And this is the Helping Older Parents video podcast, where I cover the best ways to support aging parents and other older loved ones so they can live better lives in their later years. I also often address common caregiving concerns and dilemmas, like what to do if you're worried about an older person's memory or safety, how to deal with Alzheimer's and other forms of dementia, and how to help your older loved one get the care they need. In today's episode, I'm going to talk about something that is really relevant if you are trying to figure out whether your aging parent needs more help or can keep living at home. And that is, how is your parent doing with their ADLs and IADLs? Those terms stand for activities of daily living and instrumental activities of daily living. They are basically fundamental self-care activities that we learn to do early in life. And in my line of work and in much of elder care, assessing them is key to figuring out how much help an older person needs and how we can support them so they can still have the best possible quality of life and well-being. ADLs and IADLs are also often relevant to things like determining what stage of Alzheimer's or related dementia a person might be in, determining whether it's mild cognitive impairment or dementia that an older person has, qualifying for certain elder care programs or for long-term care services, such as nursing home care, and even getting long-term care insurance to pay for services. Personally, I really like ADLs and IADLs because they are practical, and they give me a very practical understanding of where an older person is struggling in life and how we might be able to help them. So, let's now help you understand what they are and how you can assess them in your aging parent. Specifically, in this episode, I'm going to cover what are ADLs and IADLs, what's the difference between ADLs and IADLs, how to assess ADLs and IADLs, and why we do it. Let's start first with activities of daily living, or ADLs. ADLs are foundational self-care skills that we usually learn as very young children. They are also sometimes called basic ADLs. They include activities such as walking, or otherwise getting around the home or outside. The technical term for this, by the way, is ambulating. Feeding, as in being able to get food from a plate into one's mouth. Dressing, as in selecting appropriate clothes for the weather and occasion and putting them on. Grooming, which means adequately managing your personal appearance, such as your hair, your makeup, or your shaving. Toileting, which means getting to and from the toilet, using it appropriately, and cleaning oneself. And bathing, which means washing one's face and body in the bath or shower. There's also one additional ADL, which is sometimes referred to by professionals, and that is transferring. This means being able to move from one body position to another, such as being able to move from a bed to a chair or into a wheelchair. It can also include the ability to stand up from a bed or chair in order to grasp a walker or another assistive device. This ADL is mostly relevant to people who've developed mobility difficulties for some reason. So that's what ADLs are. Let's now go over IADLs, instrumental activities of daily living. These are key life skills that we usually learn as teenagers and that are necessary to live independently as adults. They require more complex thinking skills and often require organizational skills as well. They include managing finances, such as paying bills and managing financial assets, managing transportation, either via driving or by organizing another means of transport, shopping and meal preparation, which covers anything required to get a meal on the table. It also covers shopping for clothing and other items required for daily life, house cleaning and home maintenance. This means cleaning kitchens after eating, keeping one's living space reasonably clean and tidy, and keeping up with home maintenance. Managing communication, such as the telephone and mail. And then there's managing medications, which covers obtaining medications and taking them as directed. Now, as you might imagine, not everybody learns to manage all IADLs as young adults, because depending on our life circumstances, sometimes we've never been in a position to learn or have to be responsible for certain IADLs. So when it comes to assessing IADLs, we always want to be mindful of whether someone's abilities reflects a change from what they were able to do earlier in adulthood. So for instance, if someone never had to manage finances and now has difficulty when asked to do so independently, we would want to note that this is an IADL that they weren't responsible for earlier in life. Whereas if they used to manage their own finances and now they're struggling, we would definitely want to note that this is a decline compared to the way they were before. Now, people sometimes ask me, what's the difference between ADLs and IADLs? In terms of history, ADLs were defined first in the late 1950s by a geriatrician named Sidney Katz, who wanted to help healthcare providers measure changes in physical function for patients being treated for physically disabling conditions such as stroke or hip fracture. They were basically trying to define what it would look like to recover to independence, and he decided that a person's ability to function in these core skills, which in fact we usually learn as toddlers, was pretty reflective of how independent you could be as you recover. However, it soon became apparent that being independent requires more than being able to walk, get dressed, or otherwise complete your basic ADLs on your own. So, about 10 years later, another expert in eldercare, a psychologist named M.P. Lawton, developed the Instrumental Activities of Daily Living scale to assess for additional skills that might not show up on the ADL skill, but were still often relevant to living independently. And many of these ended up being the practical life skills that we usually learn as teenagers: managing money, managing a household, dealing with groceries, driving, and so forth. So in terms of the difference, ADLs, I would say, are more physical, and IADLs are more cognitive. That said, memory loss or thinking problems can certainly affect an older person's ability to do their ADLs, and physical health problems can affect IADLs. You could easily have trouble with grocery shopping if your arthritis is so painful that you can barely walk. For me, the way I think of ADLs versus IADLs is this. ADLs are the toddler skills, and IADLs are the teenager skills. Because IADLs are more cognitively demanding, that's often where we first see people with memory loss or early Alzheimer's struggling. And, lastly, it's much easier for a spouse or family member to fill in and help with IADLs than ADLs. If somebody needs help with walking or getting dressed or toileting, that's going to be a lot more work for family or paid caregivers to manage. Okay, let's now talk about how ADLs and IADLs get assessed. In geriatrics and in healthcare, we call this assessing function because we're assessing how well the person can function when it comes to core self-care tasks and life tasks. How do we do this? Well, it's actually not rocket science. It can be done by physicians, but also can be done by many other providers, such as nurses, social workers, and different types of therapists. What we do is we usually have a list of the ADLs and IADLs, and then we need to find out if the person being assessed can do the tasks. Now, it's important for you to know that for each task, we're usually going to score their ability to do it on some type of scale. That's to say, for each task, we're often considering things like, how much help does the person need to perform the task? As in, no help, some help, a lot of help, or are they fully dependent? And then we might also consider how often they need help. Never, sometimes, often, or every time. If you want to try gathering this information, I recommend doing the following. First, get a worksheet on ADL or IADL assessments. I have one available for free on Better Health While Aging, and I'll link to it below with the episode notes, or you can find one by Googling online. Next, you'll want to gather information on your parents' abilities or your relatives' abilities. What's most accurate is if you can observe them directly, or if you can talk to someone who lives with them or otherwise is likely to know how they're doing on a daily basis. Now, you can also ask your parent or older loved one how they're doing on all these tasks. That said, especially if your parent is having memory loss or thinking problems, they are probably not going to be accurate reporters of their abilities. Furthermore, even older adults who are not cognitively impaired are often uncomfortable revealing difficulties to family members or others. So although you can ask your parents if they're struggling with any of these key life tasks, be mindful that it's often a touchy subject for older adults. And somebody who's having memory loss or signs of Alzheimer's is extremely unlikely to give you accurate information. Now, it's true that ADLs and IADLs were originally designed to be assessed by healthcare professionals. But personally, I think it's a good idea for families to learn to assess them as well. Why? Well, I think it provides a handy structured way for you to get a sense of what your aging parent is struggling with. And then once you have that information, you can do a lot of useful things with that knowledge. For instance, you can help your parent report it to their doctors so that their doctors can try to figure out what underlying health problems are causing the difficulties with ADLs or IADLs. That's important because when an older person develops trouble with ADLs or IADLs, that's the sign of a physical or cognitive health problem interfering with their abilities. And so we really want to find out what's causing the problem. It might be something that we can treat, and even if it's not, there are often ways to manage it better. You can also use what you learn from your parents' ADL and IADL assessment to anticipate certain safety issues so that your family can come up with a plan. For instance, an older person who's having trouble with finances will often benefit from getting a little bit more help and supervision on that front. And if your parent wants to age in place, as many people do, then it's essential to assess ADLs and IADLs because that helps us identify areas in which your parent might need extra support or supervision to remain in their home for as long as possible. Now, you may be wondering, well, how does aging usually affect ADLs and IADLs? And what if your older loved one is developing problems with memory loss, dementia, or Alzheimer's? How does that affect ADLs and IADLs? Well, that's what I plan to cover in an upcoming episode. So, if you have a loved one with memory loss, please subscribe to the channel or otherwise stay tuned. And I look forward to seeing you again soon.